Hi, I'm Emma Osborne, and this is my 6th sports med project. For this project, I will be focusing on the post-surgical rehab behind a rotationplasty. In this presentation, I will be explaining what a rotationplasty is, the candidates and some reasons behind the surgery needing to be performed, the risks of the surgery, alternative surgeries that can be performed, the steps of the surgery, and the post-surgical rehabilitation and aftercare that each patient needs to follow after their surgery. A rotationplasty is a surgical procedure used to treat bone tumors in children that occur near or around the knee joint. The ankle joint is converted into a makeshift knee joint, and the child is fitted for a prosthetic so they continue to function in a somewhat normal sense. Reasons behind this surgery are usually for the treatment of a bone cancer in or around the knee joint in younger children, usually under the age of 12, who still have a lot of growing left to do that other types of limb salvage surgery options would not work as well. This surgery can be performed as long as the main nerves in the lower leg can be saved, since they are needed to maintain leg function. A rotationplasty allows the child to maintain a very active lifestyle, and as the child grows, the prostheses will be lengthened. The physical risks behind this surgery are very minimal. The main concern of doctors are the psychological effects resulting from the strange appearance of the rotated limb. The most devastating physical complication after a rotationplasty that can occur is vascular compromise of the rotated limb, which can result in eventual above-the-knee amputation or possible hip disarticulation. But this is a very, very rare side effect. During the surgery, the bottom of the femur, the knee, and the upper tibia are surgically removed, taking out the affected bone and soft tissue around it. The lower leg is rotated then at 180 degrees, which is why it's called a rotationplasty, and then attached to the femur. The foot now is on the end of the thigh backwards. Because it is backwards, it can now function like a knee joint would. Since the surgery is very complicated, the post-surgical recovery process is a very long and hard process for the patients. After the surgery, the patient will be required to stay in the hospital, often up to a week, to be monitored for any complications. After, the patient will go home in a cast, and the cast will be removed around 6 weeks later. After the bone and wounds have healed, the child can be fitted for a lower leg prosthesis and will start the therapy process. Therapy helps the patient learn to use the ankle joint as a knee joint, as well as strengthen the muscles around the new formed knee, as well as how to walk with the new leg or prosthesis and how to wear and adjust it. The length of therapy can vary from patient to patient, but it usually lasts around 6 to 12 months. After the patient has finished with the bulk load of therapy, they will need to make sure that they keep up on strengthening the muscles around the new knee joint, and they can continue their lives relatively normal. As the child continues to grow, they will need to be fitted with new prostheses as they increase in height. There are 2 different types of alternative surgeries for this kind of bone cancer or cancer in the leg. The first one is a limb salvage surgery, and the next one is a full amputation of the limb. The limb salvage surgery helps to preserve the leg by removing the tumor as well as a wide margin of healthy tissue surrounding it. The goal is to preserve as much use of the limb as possible and preserve as much limb function as well. The one downside for this is that the limb will never be as strong as it was previous to surgery, and the child will not be able to do high impact sports. A full amputation is usually needed if the tumor cannot be completely removed. For example, it involves the nerves and blood vessels. All in all, I really enjoyed learning about this surgery because it was very interesting and very unique, which is the reason why I chose it. Thank you so much for listening to my final Sports Med 3 presentation.